Welcome to this Autism Ontario webinar, Youth and Caregiver Perspectives of Mental Health and Navigating Support. My name is Matthew Lay, and as always, I will be your host. Today we have with us a friendly face. Dr. Patrick Jachyra has been with us many times before, and he will be delivering a presentation today that is very topical in nature, and will be joined by a number of others on the panel. But before we get started, I have a few things that I must say, as I always do. Opinions reflected in this workshop are those of the speakers and the presenters and the panelists and do not necessarily reflect Autism Ontario's views. Please note that Autism Ontario does not endorse any specific therapy, product, treatment, strategy, opinions, service, or individual. We do, however, endorse your right to information. Autism Ontario strongly believes that it is important to do your own research and make your own informed decisions, which is one of the reasons why we hold this series. During this presentation, we're going to be using certain types of language. Autism means something different to everyone. Medical professionals, researchers, providers may use one term, while individuals and their families may refer to themselves and their family member differently. The different terms you'll hear used to describe autism are either person-first perspective, example, person with autism, or identity first label, example, autistic person. First person language reflects the idea that autism can be separated from a person and doesn't define them, similar to the phrases such as living with autism. Well, identity first language reflects the belief that being autistic is an important part of a person's identity and cannot be separated. To respect both perspectives, we will be using both terms interchangeably throughout the workshop, with respect to any label you personally choose as well. Okay, so throughout this presentation, if you've never been here before, my job is simple. I'm here to get you answers to your question and keep the presentation moving along. And so you can submit your questions at any time using the Ask a Question box. Those will come and be filtered into me, and I will aspire to get you answers. There's a lot of you out there today, so we may not be able to get you all the answers live. We always aspire to get you answers after the fact, if that is the case. If you have any issues, you can click on the help button and make sure to check out the resources. There is a lot in there that help inform our conversation today. And you can go in there at any time, download the package, and I will be referencing some of those items throughout the presentation as well. All right, with all of that out of the way, I am happy to welcome our panelist, Patrick Jachyra, Dr. Patrick. You know, I know you well, a lot of us do, but some people may not. Can you tell us a little bit about yourself, a little bit about what it is that you do day to day?
Hi, Matt. Great to see you and great to be back. And hello to all of our Autism Ontario viewers, and welcome to our panelists who you guys will meet in a second. We're all excited to be here with you guys today. As Matt said, I'm Patrick. I'm an assistant professor, which is a fancy title for scientist. So my work involves doing some research with autistic youth and oftentimes parents and caregivers, and also doing a bit of teaching at the university. My work really focuses on how can we support neurodiverse youth and or autistic youth as best as we can with regard to their mental health, their physical activity, their physical health. So for me, I'm really keen on understanding how does our physical health and mental health connect. But with all of that, I think it's also important to sometimes bring the research to the fore, because researchers are really, really good at talking to themselves. But it's also important to make sure that research that we do brings an impact. So forums like this one, I think, are incredibly important to bring the research kind of into the real world. So really appreciate the invite, Matt.
Excellent, excellent. And you know, I agree that, you know, one thing that's most exciting about this is we have a number of advocates that will be joining us, both with some really great pre-recorded videos as well as live on the session. But the overall topic, why is it important to be talking about this right now?
You know, I think mental health is one of those things that, you know, over time has changed big time from how we used to conceptualize it to where we are now. And one of the important things is that we have, you know, different strategies to support our mental health. The needs of autistic youth especially have become a really important topic raised by families themselves. And so families have come to researchers, to people in hospitals to say, we need some more support and we want to work together with you guys to get there. So again, it kind of reminds us that we're not alone, especially during difficulties. And I think that's gonna be one of the messages you guys will take away today, hopefully. But also the need to keep doing research to try and advance ways to support mental health as best as we can for not only just our autistic youth and caregivers, but also adults and self-advocates throughout the life course. Because as we know, and we'll get into the specifics, mental health kind of is a lifelong important journey that we all have. So that's some of the specifics we'll get into today.
Excellent. And so the plan for today is going to be to introduce mental health. So Jonathan's going to do a presentation. It should be about 15 minutes or so. We're going to let him kind of do his thing there to set a basis. We're going to hear about your project. And when we're done there, we've got, we'll introduce our panelists, but we've got some videos that were done, I believe, at the start of the project, as well as at the end, sort of some reflections. Following that, we are going to bring everyone to the table. We're going to do a roundtable, get your questions answered, and then Jonathan will have some parting words for us. So with that, sorry, Patrick will. So with that, Patrick, I'm gonna go to the I'm gonna go back a slide here because I did want you to cover the trigger content warning. And then what I'm going to do is I'm just going to give you control so that you're able to control the presentation. And so at this point, if you want to go ahead and get into it, I will leave you be for a moment. If you have any issues with the slides, I'll jump in on that in a moment. When
Fantastic. Thanks, Matt. I think before we start, just important to remind people that discussing mental health research can be sometimes a very difficult and emotionally distressing kind of experience and phenomenon. And so one of the important things we wanted to do today was to kind of give you just a content warning. If you feel at any time uncomfortable, feel free to kind of walk away, to take a break, to stop, to exit the webinar. But it's also important for you guys out there in the virtual world to, again, get support as needed. And we've included a few kind of phone numbers here. You'll see a phone number for immediate support. Autism Ontario has also developed some get support document, which is attached and is going to be a resource available. And again, it's just important to keep that mental health consideration in mind kind of as we go through with some back-end support with the Q&As as they go later on. So without further ado, why don't we jump into some of the content so that we can hear from the youth and the parents themselves as they are, the most important. Again, an important goal for today is to kind of listen and learn from the stories of the youth and the caregivers who are involved in this project. We have really done a good job, especially engaging kind of researchers, but an area that has been somewhat missing has been that caregiver perspective and especially youth perspective, which we're going to get to in a moment. So that, I think, is one of the most important parts of today. And before we get there, we'll talk about, what is mental health, why does it matter, and what we know in terms of the research. But an important takeaway also for today is that, again, we're going to be talking about people's stories and also kind of the rationale for the project that we did, which we'll get to in a second. But we're not here necessarily to provide kind of ideas on how to provide care, because that's outside the scope of the webinar. But again, we do encourage you to go get support through the usual kind of avenues and channels. And, when in doubt, contact those resources that we've provided earlier. So to get us moving, I thought we'd kind of talk about what is mental health, right? It's a big buzzword. We hear it all the time. It's in the media. It's on TV. It's in movies. It's just everywhere, right? And I think sometimes it's important to just define what we mean by that term. And it's become like a bit of a catch-all, right? It really encompasses a lot of different types of things. And according to kind of mental health in the US from a government agency, they talk about it being a social phenomenon. It impacts our emotional well-being. It's psychological in nature, but also can impact our physical health. And so mental health really impacts how we think, how we feel, how we act. And, it's part and parcel of how we just kind of interact with the world. So again, mental health isn't just this thing that we have or don't have. It's something that's kind of always with us. And it's just important to recognize that. again, it's present in all parts of our lives, from childhood all the way through adolescence and even into our adulthood. And so again, it's one of those things where it's used very loosely sometimes, but it'll be our goal today to try and focus it a bit more in terms of the support needs and how do we navigate certain supports in some healthcare systems. Oftentimes we get this question, kind of, Patrick, what is mental health? How is it influenced? I mean, we've talked about it so much, and I thought we'd put some quick information together, just kind of what we know from the research. So we know from the research that there's a range of biological factors that can influence our mental health, from genetics to our brain chemistry to the way that our brains are wired. And that's kind of the biological angle that influences our mental health on a day-to-day basis, right? And some of that we don't necessarily have control over. But that's okay. And that doesn't necessarily make something better or worse, but it's just to recognize that there is a biological basis for our mental health. We also know that mental health is influenced by our own life experiences, right? So for those of us who've experienced any kind of trauma, grief, sources of tension and war, catastrophes, we know from the research that that impacts people's mental health in many different ways. And so it's important to recognize, again, that we're not here to necessarily blame people for their mental health, which sometimes has happened in research, but in fact, we're trying to advocate the opposite, to recognize the person before any sort of mental health challenge. And we also know that there's, sometimes a family history. So that doesn't, again, necessarily blame the family or the person. It really reminds us that, again, mental health is so fluid and it can change over time. And it's part of, recognizing that it's not fixed and that there can be ways to support our mental health over time. One way to really illustrate that is this kind of continuum model of mental health. So as you'll see kind of in the middle, it's a continuum, right? It ranges from all different types of areas, from no symptoms of mental illness all the way through to potential serious mental illness, right? We have this idea of kind of optimal well-being. And sometimes, with the way that life can be and certain things that can happen, plus our biology, we might have poor mental health and well-being. And again, the idea of the continuum is to remind us that mental health is experienced so differently by so many different people, and there's not one right way to do it. But I think the more important message about mental health isn't just necessarily the biology. There's tons of important research happening on how we can better understand mental health challenges, but then also how you can support them. But it's this message over here from our colleague, Dr. Jachyra from the Center for Addiction for Mental Health, who advocates for individuals with mental health challenges and support needs. And she's really well known for saying this quote, which is, everyone is deserving of hope and help, connection, and access to high quality mental health care. And I think that is a fundamental right as human beings. And sometimes it's important to remind ourselves of that, because again, we are deserving of all these things. And regardless of the mental health challenges or the lack of challenges someone might experience, it's important to have access to that care in times of need. Now, you might be asking, how does this relate to the mental health of autistic youth, and how is this all connected to today's webinar? Well, let me tell you. I think it's important to start here to talk about the research again and draw on what the research shows, that youth and young adults tend to experience higher rates of mental health challenges. So especially youth with autism, neurodevelopmental differences, or like we said, autistic youth, we see in the research that they're more likely to visit the emergency department for psychiatric reasons. And we also see that they experience difficulty accessing and receiving appropriate care. So not only is it a barrier to kind of get to the either emergency room or to the doctor's office or to the psychiatry office or our psychologist or social worker, there's so many barriers to get there. But not only are those barriers there, it's difficult to get the care that they need. We also know, for those of us who've kind of live in Ontario and Canada and other parts of the world, that there's difficulties with accessing care, and especially during the COVID era, who, has really disrupted the lives of autistic people in many different ways. And we know that impacted mental health. And so again, I think it's important to recognize that not only are there big barriers, but there's wait times, and sometimes mental health needs more of an urgent need. The third kind of piece to keep in mind, not only do we have barriers, we also have something that we are discovering in the research, that some healthcare professionals, especially in this US study kind of identified in the slide, so that they experience some low confidence and a lack of experience and a lack of knowledge actually supporting autistic adults in mental health situations. And so that raises this kind of really difficult situation where not only is there challenges to get support, but when people do get through the door, they might experience even further barriers. And so one of the calls that have kind of come together from parents, from youth, both in Canada and the US and the world, is to say that we need more work in this area. We got to do better. We've got to find ways to support people better. And that's this idea of having more tools, ways to develop mental health interventions and services that not only meet the needs of autistic people, caregivers, and their families, but again, also being able to access it in times of need, because as we know, that might be a barrier sometimes for some people. So how do we go about this project, recognizing the mental health support needs and challenges that autistic people and neurodiverse people experience? So initially, we had the Province of Ontario Parent Advisory Council and the Youth Council identify that areas of mental health need further support and research. And that was kind of done with Dr. Evdokia Nagdastu, who many of you might have met before on a previous webinar. And so they met with her and they said, well, we need more, but we don't know where to start. And one of the things that were identified was to figure out how can healthcare professionals help. And after figuring that out, Dr. Agnastu, the Pawn Parent PAC, and the Youth PAC, again, there was a group of youth who developed this entire project, partnered with myself and Dr. Yona Lunsky at the Center for Education and Mental Health to try and find ways to address kind of this gap, right? Now, you might be asking, why did we predominantly introduce and use youth kind of in our study? Well, it's for this main reason that most of the research conducted has been done with healthcare professionals, parents, caregivers, and the perspectives of youth on mental health, on their support needs, on how we can better support them, have been completely absent. And as you can imagine, it's hard to provide better quality care if we don't speak to the individuals who actually need the care. And so that prompted a few research questions for us to think about. And these were the questions that we used to kind of guide a project, which you will learn a bit more about today. So the questions were, how would youth with neurodevelopmental disorders such as autism like to be spoken to about their mental health? One of the pieces of feedback that we received in that kind of priority setting was that oftentimes discussions about mental health were really difficult. And in fact, sometimes the words that were used by professionals didn't always sit well with families and autistic people themselves. And so that was a question. How can we better understand ways that individuals with neurodevelopmental disorders would like to be spoken to about their mental health? We also wanted to better understand kind of what is important to them. Why does that matter? And then what are the components of supportive mental health discussion? So if you think about when you're making a cake and you need a bunch of ingredients, this is the same idea. What are the ingredients needed for supportive mental health conversations? And so this was the general overview of the research questions that guided what we did. And so in doing so, we developed a project where youth with neurodevelopmental disorders such as autism, a range of other co-occurring conditions as well, create a digital story, which, if you guys might know, a digital story is a short video, oftentimes 2 to 3 minutes long, kind of identifying an issue. And in this situation, they discuss kind of what their mental health needs are, their experiences of getting support, and also what can be done to make them better. And so we initially did this in 2021. We started this over the COVID pandemic, which for some of you who on the call might remember was a really difficult time for us. And we did it virtually over 7 workshops. So thanks to the youth who sacrificed 7 Saturdays and to the parents on this call today as well, who brought them to our sessions each week. And they were about 3 hours long, so not a small commitment. So if you do the math, 7 times 3, about 21 hours of commitment to kind of get these stories. Now, what was the goal? We partnered with a community partner to not only make these stories, as they were the experts in doing this, but they helped us really trying to think outside the box, to think about what experiences look like. What happens when experiences go really, really well? What happens when things look poorly? And from that, the youth really shared what needs to be done and how can things be better. In terms of some demographics about who participated, we had 9 participants aged between 16 and 21, 6 individuals identified as males, and 3 identified as females or non-binary. And again, we had a wide range of perspectives from all kinds of different types of experiences And we had, again, individuals diagnosed with autism and other co-occurring conditions, including some mental health conditions, which again really drove this research. So the key, again, for this research was working with youth themselves, learning what they've gone through, what are some of the challenges they experience on a daily basis, and how we can do better to support them. Because again, some of their experiences in the healthcare system were great, and other ones were very lackluster and were really an area that needed support. So I thought that to kind of give you an idea of the project and what we actually did, I thought that we can screen some of the stories. And Matt, I'm going to pass it back over to you to kind of help us and help the audience kind of get an idea of what Patrick's been talking about, because it's a lot easier to see them than to have me describe them.
Sounds good. Sounds good. So as you mentioned, we've got a number of folks with us. So what I'm actually going to do is I'm just going to go around to let everyone know who's here. So what I'll be doing is I'll be introducing each of our panelists, and they can go ahead and wave when I do that. So I'm going to start off with Jonathan. So Jonathan, thanks for being here. There you are. I got you. Thank you. Now we're going to go to the next one. We are going to go to here is let's see. We got Shannon. So Shannon, I will bring you in now. All right, I was trying to do this an easier way. I'm going to do it the old-fashioned way, clearly. So there we go. Gonna wave it in, and then we've got a few others with us as well. We got Danielle. Okay, so now you're meeting all of our various attendees. So with that, we are going to go and we are going to play some of the videos. So when we do that, you're going to watch the videos in the All right, so we're gonna watch some of the videos, and from there we are going to come back and we are going to chat about them after the fact. So I'm going to start off with our first video, and we will go from there.
Matthew is in the backseat with his brother, and he tries to talk to his mother about his negative thoughts and irritability. His mother replies in a stern tone that she will not be discussing this at the family party, since their social worker advised her to not feed into it. Matthew feels even more frustrated and anxious after each second. After they arrive, Matthew manages to talk to his oldest cousin, Jacob, about his frustrations with school and negative past events. Matthew says, so it's like every day I feel as though I have no escape from my angry thoughts. I just don't know how to let things go. It's like all I think about are the events in my life. Jacob replies that the best thing to do is to move on. Matthew asks, how? Jacob says, you just gotta find your own way. This leaves Matthew feeling puzzled. Matthew has been holding on to grudges since grade 8. He always was told to let things go, without being told exactly how the person who hurt him will be dealt with. Back at the party, Matthew begins to feel even more irritated, with memories and thoughts becoming more intense. Matthew pleads with his mother to let him confide in her. She tells him to stop and tries to ignore him. Even more thoughts come rushing into Matthew's head, ranging from times when he was 8 to every single unpleasant moment he experienced more recently. Matthew tries to talk to his mother again, but she remains silent. Finally, Matthew snaps. You! The party goes silent, making all eyes go on him and his mother. Feeling embarrassed, he storms out of the living room. He begins to hit himself in the head, and when he reaches a nearby mirror, he throws a punch at it, which completely shatters it. Matthew, being even more upset and embarrassed, goes upstairs to hide. Ignoring Matthew's negative thoughts didn't help in that particular situation. Matthew needed support to help himself calm down. He needed his mom or someone else to help him regulate his emotions. The idea that Matthew should forgive and forget was too abstract for him. What helped him the most was clear and direct and concise language. Eventually, with a lot of support and practice from social workers, Matthew will learn strategies and skills and be able to calm down on his own.
Okay, so that was the first video. That was from our first panelist, Sheldon. We're now going to move on to our second video, which was Jonathan's video. So I'll go ahead and I will move on to that video now.
By the time I was 10, I was so stressed that I was shouting out in class, and I had to leave the classroom and go for walks all the time to calm down. Many teachers did not understand my nonverbal communication and didn't include me in the class activities. My neurologist also found the doctor who gave me the right diagnosis, Tourette's. This radically changed the way that I saw things. I wasn't going to die, and I learned to self-manage my symptoms. By secondary school, I was included in a lot of social and academic activities. I felt loved and encouraged by the teachers. They gave me guidance to allow me to live my best life. Now, I am a student in Indigenous Studies at Trent University. I have grown personally, spiritually, and academic, and want to go into Indigenous law. Over the years, my neurologist congratulated me for my day-to-day wins like self-managing my academics, and the big wins like being on the honor roll in high school and getting into university. He really cheered when I told him about putting myself out there and being social at uni, like participating in the Indigenous activities. Once, I was told he helps children and teens other doctors reject and neglect to help because they are too complicated. We all deserve to be treated with compassion, respect, and to be included in conversations influencing our health.
Okay, so I'm going to come back to Patrick here. Patrick, those were very interesting, the way that those were put together. Those happened at the beginning of the program. Is that correct?
Yeah, exactly. And so, you saw in the videos that the youth not only shared their perspectives and their experiences, but also tried to use them to actually provide some feedback for future healthcare professionals, educators, parents, families, to actually watch the videos. And if the one thing that they hope was to stimulate some thinking around them, but maybe change some of their practices. And so those were examples of the two of the videos. There were 9 in total. And here we've included the website link. For those of you who are interested, you can kind of watch all 9, and we encourage you to share them with whoever you feel is right. And they've actually received some good uptake from Australia all the way through to the UK and in Canada. Slowly, these stories are being recognized as ways to potentially make change and support individuals better than the experiences that they've shared. Because again, you heard some of the challenges that they experienced with the healthcare system, and we're working on then trying to find ways to make it better.
Excellent. So the second round of videos, these were done at the conclusion of the program. Is that correct?
Yeah, absolutely. And one of the things we did afterward, one of the things, Matt, that was really curious and it really reminded us about the importance of doing this work was a lot of the youth and parents contacted us and said, well, actually, the youth really thrived on seeing a group of youth, each week. And so we thought, well, what can we do to kind of bring the youth back? What can we do to kind of keep their stories alive and going? Because as we know, with media cycles and with stories, we launch them, we get lots of interest, and then the interest kind of fades away. So we thought maybe having the youth speak about why they made the stories, why they were important, and to hear that from yourselves rather than me always talking about how important it is, I think that was the most powerful message that we would want to share with you guys today.
Excellent. Okay, so now we're going to move to Sheldon's video. We'll be right back after we go through that.
I'm Sheldon Gaboury, and I'm the one who wrote Matthew Norman's unhinged story. I'm here to discuss about the outcome and the possibilities of healthcare practitioners helping out with people with this exact condition. I would like to tell why I actually decided to participate in this study and how I actually managed to overcome these obstacles myself. So it all started when I was in high school, when I hit puberty with a bang, and I didn't know how to control myself at times. And that scene where Matthew Norman punches out a mirror in the story is what happened in real life with me. I was that angry and that unfocused at times. The reason why I participate in making these videos is because I wanted to help out with people in my exact condition, to show them that they're not alone. Making these stories was important because I wanted to show people that there's no need to stigmatize people with anger management issues. I learned that everyone is on the same path when it comes to struggling with their mental health. I am currently happy with myself. I got into various hobbies. I have gotten a job at landscaping. I managed to control my anger much better, and I don't usually get any more negative thoughts anymore these days. He helped me shift my focus and explain to me why my brain wasn't able to shrug off negative thoughts as easily as others. I hope that you will all be inspired by Matthew Norman.
Okay. And just like we did the first time, we'll go to Jonathan's follow-up video now.
Wherever the word for hot good for the about of hot good the word for the vessel or for a vessel for a both the also the about hot the vessel of hot vessel about word that the all about unapologetic of it not what for the other because first thought not good for but at about then but get at got my blood maybe go do for good the for our proof for I get the for the at our for I but can't make for in met outfit that fake cafe at but made thing for but I will take care of what for birth with the fucking met well for birth for the for outlook then with the fruit comes out the all get back get for for the again for us for the out for the out for us well the I will go out for the big for my work I can take you through a buffer do for the house right and out for the good market for the good for much out what the or feel good for out out what the look about the of your boys has food, but I get the food, but out for goes for out one. I've met out for the I that's what we're talking about the use. But I guess for Homer goes out. But we at the day, I got outfit old. Oh, out for the out that fan I think I thought master must be out master out that old I was good that I refer to but okay where I get the I will I go there yes where there was a day for the heart of a roof or the here at the very day oh the at the very day I was free I thought or the game of but I come there for that with my phone with do at half a good for the game do block the fall for the for at a good for yet for fun a hard rubber fear over for the cut look out and get a day or after the other day but they are very good like a better day for the Bahama Bay out there us for the me the for go out go for free the for the day for one perfect one microphone then get the my better get the good I forget the but I for the youth I hope it much better for you. A bit rough for how good I remember the whole brother food. Look at me, look at it. I wish you did. I got this. I'm gonna get out there for the really get like you. Yeah, they will get but a booth. The circuit that I both do. I can take the first what they do it. What they do food. I mean, different other for the I give it but the number I forgot let have it out of her. Other give for clean my I don't know about the five.
Okay, so now we're going to move on to the parent advocates. I know I didn't do a great job of introducing the first time around. So, Patrick, can you tell us a little bit about the videos that we're going to be seeing next?
Yeah, so you're going to see two quick videos, one from Shannon, who is a mother of a young man who participated in the digital storytelling project. I think she has some really valuable things to share, kind of just through her journey. And the second one is Cathy, who also is live with us today. Super fantastic. And also will give us, again, some just different insights on what is it like to, be a mother of a young man who described the story that he did today. So without further ado, I'll pass it back to you, Matt.
Sounds good. Okay, we're going to do both of these videos back to back, and we'll be right back with you.
Hi, my name is Shannon, and I have an 18-year-old autistic son who also has ADHD and generalized anxiety disorder, and approximately 2 years ago, he started experiencing signs of depression. And since then, we have been on a bit of a rocky road trying to get him appropriate help. And yeah, just with wait lists and timing, it has been a challenge to say the least. So I feel like we are getting there, but it's been slow. It's been a slow process. I would say we have a really great pediatrician who, even though my son is now 18, is willing to keep us on and until things are a little more settled and we have a good care plan in place, and the transition to our family doctor can be a little smoother. So we're almost there. And he's been a great support to our family. For the digital storytelling project, it was a very positive experience for my son. I was sitting on the pond pack at the time, and I encouraged him to be a part of the project. He wasn't so sure about it, I think, at the time, but once he got involved with it, it went really well. I felt that he felt very supportive and very much he could just be himself. With the other participants, he was just kind of accepted for as he was. And the professionals that were involved in the project were very supportive and did a wonderful job. He also, I think, really positively was able to express himself in a way that he's comfortable with, which is through his art and his animation. So allowing him to use those skills that he feels really good about was also a very positive experience for him. I think it's amazing where the project has gone. My message to service providers would be to be as flexible as you possibly can and open to listening, really actively listening, and to really take the time to validate the caregiver's perspective of things. My son has the ability to answer questions the way that he thinks you want them to be answered. He has a very hard time sharing information about things that are challenging for him with people he doesn't know and hasn't had time to build a trusting relationship with. And so he will appear to be fine. He's very verbal and can express himself very well, and he is very able to go, through an appointment and make it sound like everything's going really well and there isn't any problems. Whereas the flip side of that is he's experienced a lot of challenges right now. There's a lot of things that are happening that are really difficult for him. And so the caregiver side of things needs to be listened to and really validated. And my son needs time to build, those trusting relationships with a service provider so that he can feel comfortable expressing things he's having challenges with at the time. And my message for parents would be really just that you're not alone. And, you're not crazy. If you are, feeling that things are really challenging and difficult, then please reach out for help wherever you think you can. Autism Ontario has been a great source for me. As I said, our pediatrician has been very helpful. And ask for things that you think you need. I asked for referral to CAMH. I wasn't sure how that was going to go, but I felt that was, the best solution for us at the time. And my pediatrician listened and took in what I was saying and was really willing to understand what I was going through and kind of believe what I was saying. So just, you're not alone, and reach out for help. It can be challenging, but it does exist. It is out there, and things can get better. Thank you.
I'm Cathy Gaboury. I'm Sheldon's mom. Sheldon and I always try to keep active in the autism research sphere, and we were happy to participate in this digital story making because we find that it's pretty hit and miss with healthcare practitioners who are able to help people on the spectrum, particularly with mental health. When Sheldon hit puberty especially, he, even though he was already in therapy, he became overwhelmed by feelings of anger and things that every teenager goes through. So we were lucky in our first ever psychiatrist that we got. She just retired from sick kids, so we were able to see her whenever we needed. Everything was done very scientifically, and we would try a new med, see how it went. Then when she retired again, we were moving into adulthood, so we've gone to a new practitioner who unfortunately didn't have a lot of autism experience, though has done a lot to try to come up to speed kind of thing. But I find it's very, here, throw more pills at things, which makes us a bit uncomfortable. And we still continue to struggle. We've also had a lot of times when he was a teen where we were looking for help, and those that we went to would give advice and talking. I remember that particular video was the outcome of a bunch of social worker type people giving us advice on not walking on eggshells, as if everything was just that we weren't parenting properly. So that's really disheartening when that happens. The thing as an adult that I find is that healthcare practitioners don't want to necessarily talk to you even when your adult child gives permission. So when he was hospitalized early this year, he called to go himself. But unfortunately, we all had COVID at the same time, which is probably what led to it. The day that they let him out, they'd thrown him, he went in on one medication, he came out on 5. They put him on 2 new meds just that morning, and very heavy duty meds, threw him out the door, didn't tell me anything, said, it's too cold to talk to you out here, and I couldn't go inside. And I finally had to go, I was going to my MPP, to the head of the hospital, everybody, to try and get the doctor to talk to me after a week. When I finally did talk to him, he thought he had Tourette's, which he doesn't. He thought a bunch of things. And it just was the communication isn't there. And the support from the family, I think, is important with everybody with mental health issues, but even more important when people are on the spectrum. So the fact that that isn't prioritized it's shocking to me. So that would be where I'd hope that some of these stories would have an impact on people helping with the entire support group that the patient comes with. But we're very happy if anyone can be helped with the stories, and that we're able to influence anything like that. And I think it was a learning curve for us too, and made us sit down and think. That actual story, I hadn't been aware that he still thought of it that way. So it was an interesting story for me to view when it came out. Thank you.
Okay, very interesting. Now I'm going to bring everybody back here. We're going to do it in order. So Patrick is back. Next, I'm going to bring back Jonathan. Welcome, Jonathan. Looks like we have two here. So I will bring back. Might need some help there. Shannon, I'm going to bring you back as well. And Sheldon and Cathy. So I think I have everyone. Eric, my producer, if he can help me a little bit with which of Jonathan's feeds should be brought in, that would be great. But really, really interesting stuff, everyone. I'm going to start by going to Shannon. You gave that video was recorded, I think, in 2021. Can you talk to us a little bit about how your perspective may have changed since then, now that we're entering 2023?
So Lucas's video, I think, was done. My video was done not too long ago. Okay. And I would say, yeah, so my perspective has changed in the sense that when Lucas did his video, he wasn't experiencing any really serious mental health challenges, and then since has. And so I have more of personal experience with trying to find help, and it's just really challenging. And to find the right help and the situation that kind of fits your child when the needs can be pretty complex.
Sheldon and Cathy, have you guys seen much in the way of changes? Has your perspective changed much since those videos were done?
My perspective on apraxia or
apraxia. On your situation, how are you?
Pretty good,
We've Sheldon's actually in a really good place now. We randomly, as I talked about, one of the drugs that they threw him on worked. Then Canada ran out of that drug, so now he's on a different one, which is actually working as well, but with less side effects. So kind of feels like accidentally we've finally lucked into the right combination, and he's doing really well, and best he's been in mood and all that kind of thing since he hit puberty 10 or 15 years ago. So we're finally in a good place. But
that's great.
The struggles we went through in the meantime is what we'd like to help other people not go through, because we really found there was not good care and much to do when we were really struggling when he was young. Actually, a KINARC program really helped us when he was young, but they opened it up to us because it wasn't something he was eligible for. So everything we got through the back door, it feels like, and with lots of work and struggle. So we need to find a way to make it easier for people to get the help they need.
Patrick, does this surprise you at all about, what maybe has or has not changed since the end of your program?
Yeah, and I think, one of the most important things that we learned today was kind of that parent story, and listen to the youth and recognizing again that there are areas of improvement. I think the pandemic in some respects has kind of made things more challenging. In other respects has kind of tried to fill that gap with more digital things. We're also hearing from people that they're done with the digital, they need in-person appointments. And so, it's hard to kind of put an exact finger on, has it got better, has it got worse? I think there's been some changes, but again, it just reminds us that there's always work to be done. And I think our stories, especially with Jonathan, reminded us we need to see people as people before their label, and the rest of it can come later in terms of finding ways that support them best. And that's kind of one of the takeaway messages that we have kind of in our talk today, is kind of building connection before correction, right? We're not here to just try and fix someone. Find something that they can identify with, connect with them as human beings before their label, and try and find ways that actually work for them. where again, that is the long-term goal, and hopefully we get there sooner rather than later.
Excellent. I'm being told that Jonathan's camera, if you can hear us, Jonathan, is turned off right now. If you could turn it back on, we'll help get you on the screen. I know we have some takeaways that we want to get to, but I do want to address some audience questions really quickly before we do that. There we go. There's Jonathan. The first question that I have is, what are these strategies and skills that neurodivergent children are learning to calm themselves, and how can I teach them to my child?
Anyone on the panel who wants to give that one a go first?
One of the things Sheldon's really worked hard on and really helps him now is meditation. He's quite interested in Buddhism, but even just meditation and mindfulness. We did a few courses through, I think some of them were through Autism Ontario, but he's really engaged with that, and that really helps you, right?
Mm-hmm.
Yeah. So that's something. There was a book we had with a CD when he was young for little kids called How to Sit Still Like a Frog that the doctor recommended. That was very useful when you were at a young age and teaching some of those concepts and how to self-calm.
Okay. Another question that I wanted to get to is, how can I support my twice exceptional teen when regular supports don't fit them very well? How do I support their strengths to meet their potential?
I'll pass it back to the panel. Anyone on the panel, before I give that one a go, have a thought on, kind of what you've gone through, or any thoughts on how would you kind of answer that question?
I guess I can answer just in the sense that I try to really listen and follow their lead. So in what they might be interested in. Also trying to get out of the standard, we have to follow, especially with school, we have to follow this path, and it has to, 9 to 12 and then on to university, that trying to sort of let go of that expectation and just really follow the youth's lead in that.
Thanks, Shannon.
Anything to add there, Patrick?
Yeah, I was going to build on exactly what Shannon said. I think it's, a lot of people often hear from medical professionals sometimes all the difficulties, the negatives. We don't often focus enough on the strengths, right? So it's finding ways, both as parents, advocates, people in the system, to build on, the strengths of the people that we're working with, and see if we can kind of use that as a resource to kind of engage them in other ways. And so, again, one of the key messages to take away today is kind of being mindful of the language that we use, right? And kind of stepping sometimes away from that entire negative thing that someone is only doing bad things, but to focus on the good things, the strengths, and trying to build on those strengths to then again support them along their journey.
Excellent. Okay, so with that, we're getting close to the end of time, and people may need to leave. I am going to come back to everyone, but I'm going to let you know that we're going to be going just a little bit over today. And what I'm going to do here is I'm going to basically, Patrick, I'm going to go ahead and give you control here and let you go through sort of the takeaway items and the like. You should be good from here, and then we'll come and we'll wrap things up after that.
Sounds good. I just also want to read kind of Jonathan's comment in response to that previous question. Jonathan typed it into the chat, just saying, again, encourage your teens to socialize, find people with similar interests close to their age or situations, and to honestly, unfortunately, keep pursuing other supports and mechanisms that kind of work as best as you can. And if they don't work, I know it's exhausting, but to kind of just try and keep on going as much as you can. So with that, Matt, I think a few takeaway messages. Again, language matters. If there's any health professionals on the call, just to think about one of the youth who said in their story, medical professionals need to understand that what you say to patients can stick with them forever. And I think that's so critical, because sometimes, in medical contexts where professionals might feel rushed, parents might feel rushed, just taking that half a second to just step back and breathe, both for the patient and for the professional, to try and really make an impact, because we know that the further we push people away, the less likely they're going to come back and get support. So that's one kind of key message. We had another youth who talked about, again, in her story, My Truth, The Difficult Climb. Again, you guys can find that on the website, who said, you only cry for help if you believe there's help to cry for. And this one always strikes me, because, again, she had difficult experiences trying to get help, not being able to find anything, up until she finally was able to find someone who understood her listened to her and was able to kind of bring her a bit closer to some of the challenges she was dealing with. So again, I know it's difficult, it's definitely exhausting, but to try and find ways both from the parents' perspectives, the youth perspectives, and also the healthcare perspectives to do our best we can to try and support people and listen. I think that's the takeaway message from today, is to listen as much as we can and as best as we can, and genuinely with empathy to kind of do as best we can. I just have a final kind of comment to just acknowledge again the youth and parents who are on the call today. Thank you so much for your participation, and the youth generally in the project. None of this would be possible without you. Also, just want to acknowledge my colleagues, Dr. Yona Linsky and Dr. Evdika Nagnastu, and Community Storytelling Strategies, because again, without them, that entire project, which we talked about in just over an hour, took about 2 years from start to finish. So many thanks to everyone involved, Matt. Back to you.
Excellent. Thank you so much. I am going to bring everybody back here and basically just thank you all both for the participation in today's webinar, the program, and sharing of your stories. To everybody out there in webinar land, we know we didn't get to all your questions. I know that we tried to answer some of them by text, but there was just too much to get through and too little time. So we'll aspire to get you some of those answers after the fact. This webinar will be recorded and available on demand on the Autism Ontario website. You can go there tomorrow and you'll be able to watch it. You can share it with your friends, family, loved ones, healthcare practitioners, anyone who you think might find this content valuable. The more people we get through this program, the more webinars we are able to put on. And with that, on behalf of our panel, Patrick, always great to see you, and Autism Ontario. We look forward to seeing you again at our next Autism Ontario event.